Rule of thumb, anything ends in itis means infection slash inflammation of whatever prefaces it. So endocarditis is literally an infection or inflammation of either the walls, the musculature of the heart, or the valves of the heart. We find endocarditis comes either as acute or subacute. Okay, acute, fast onset, fast infection, fast symptoms. Subacute, well, it's a little bit longer. Takes a little longer for things to develop. Okay, this isn't a chronic. Chronic is a slow progression disease that could take weeks, months, years. Acute, measured in days to hours. Subacute, days to, think maybe a week or two. When it comes to the symptoms of endocarditis, a lot of the symptoms are going to be due to a slowed blood flow. Okay, the heart's going to be working harder, but the blood's not going to be moving as quickly or at a normal flow as it should because of the presence of bacteria, viruses, whatever. Going to have inflammation, you're going to have fever, the fatigue, the edema, member swelling due to fluid accumulation. The blood's flowing in slower, so the blood's also flowing out slower through the capillary beds, which means there's going to be more fluid escaping the capillary beds into the surrounding tissue. The weakness, the anemia, lower oxygen level, nutrient levels, the getting into the tissues isn't going to be there where it should be. You're also going to have what is called myocardial infarction, meaning that the electrical rhythm, the contractions that you would see, is going to be altered. For some patients, there's also going to be some either abdominal or side pain associated with acute or subacute endocarditis. They're not actually feeling pain in their heart, but because of the symptoms, the signals being fed to the brain is going to misread it. Kind of like when people have a heart attack, they report numbness in their left arm or numbness under their jaw. It's their brain taking in information that it doesn't know what to do with, so it just says numbness here, numbness there. You can also see what are referred to as Janeway lesions. Okay, these lesions are going to, from what I've been read, correct me if I'm wrong in an email. The Janeway lesions are going to be, think red splotches, palms, soles of the feet, capillary beds bursting. Some blood flowing in, but not enough pressure to get blood to flow out. Capillary beds just become too full of fluid. The Osler's nodes, going to be swellings, fingers, toes. The fluid there is going to cause these to swell up. For the subacute cases, you're going to also see fluid inflammation causing fluid and cells to collect in the spleen. We find when it comes to acute endocarditis, one of the leading causes is going to be bacteremia. Okay? Bacteria in the bloodstream will literally settle out on the heart valves. Okay? Because it's one of these things as the atrium, the ventricles are contracting, they're causing differential pressures in the blood. This differential fluid pressure causes the valves to open and then to be pushed closed. Well, the pushing the closed, pushing it open causes little eddies in the flow of the fluid. You've seen these eddies. You go and you watch water flow by in a stream or a river, and you'll see on the surface swirling here and there as the water tries to go in and around obstacles. Same thing happens with your blood around the valves. Under normal conditions, it's not a problem, okay? The blood cells are big enough, they flow by these eddies, no problem. Bacteria are smaller. They will get caught up in these eddies, and as more and more of them get caught up, they will begin to settle out, and they will be able to attach, to your tissues. This leads to what is referred to as vegetations, accumulations of bacteria growing on the valves. They will begin to hamper valve function. The presence of them attached to the tissues of the heart, attached to the tissues of the valve, can lead to inflammation. Inflammation in the heart will begin to affect the ability of the heart or of the valves to function correctly. One of the leading causes of acute endocarditis is Staphylococcus aureus. Yes, Staph aureus, better known as a staph infection. Somehow, Staphylococcus aureus gets into the blood, bacteremia. Next thing you know, you have it settling out. You also look at this this list here: Strep pyogenes, Strep pneumonia. These are bacteria, part of your normal flora. Neisseria gonorrhea, another one that's not listed here, but I've seen in clinical studies. Chlamydia pneumonia, Neisseria gonorrhea, chlamydia pneumonia, 2 STDs. So yeah, plaque, what we call plaque, that the bacteria growing on the heart valves causing platelets and whatnot to adhere to the valves, can be started by STDs. Side note, one of the labs I was associated working with back at the University of Louisville Medical School, they were studying chlamydia pneumonia, and they were looking at how chlamydia, which is an STD, the different types of infections it can cause. One of the things they were looking at is when patients, endocarditis patients, would have their valves replaced. They would take the old valves that were removed, and then they would study them. And they were able to detect the presence of chlamydia pneumoniae. They did study that in some of the plaques. For many of them, not all, but many of them, they also found bacteria that would normally be considered part of our oral flora. So yeah, the bacteria growing in your mouth. Turns out some of these patients saw a dentist. Dentist cleaning, dentist scraping, cut open little micro cuts in the gums. Oral bacteria got into the cuts, got into the bloodstream, settled out on the heart valves. Now, when it comes to transmission, however they can get into the body, okay? The bacteria has to get through the epidermis, dermis, into the capillary beds to get into the bloodstream. See that acute endocarditis is a big problem for IV drug users. People who have traumatic injuries or surgical procedures, just like I talked about with the dental. Yeah, that's when you look at it clinically, getting your teeth cleaned is, a surgical procedure. They're in there scraping, they're removing tissues. Now, subacute endocarditis, you're going to see some damage to the heart valves, or that's going to be initiated due to some malformation of the valves. Generally, this is going to be congenital. Congenital meaning it was a issue during fetal development. The valves did not develop correctly. So irregularities, whether it's damage, heart valve because of plaque, your diet's crap, cholesterol settling out there, blah, blah, blah. Could also be not only like I said, the plaque formation, could be the congenital, could be a host of other things. This is going to lead to irregularities in the flow of the blood, even more of those little eddies, things settling out. As I talked about, Streptococcus, Staphylococcus, there are other streptococci for subacute that are associated here. Generally, though, when it comes to subacute, the agents here that we find are lower down on the virulence. These are less virulent, low pathogenicity. But for whatever reasons, they have been shown that once they do get in, the heart valve is where they do their most damage. Disruption of the skin or mucous membranes is one of the leading ways that we get the bacteria into our bloodstream. Dental procedures, rigorous toothbrushing, minor cuts, lacerations, anywhere on your body or in your mouth. The bacteria that we find associated with endocarditis, whether it's acute or subacute, are generally not transmitted person to person. Okay, these are generally not seen as transmissible. It's something that's just part of your normal flora. If you happen to be one of these people that has a higher chance of endocarditis, they can prescribe prophylactic antibody therapies. If you do have valve irregularities, congenital irregularities, or you have an increased plaque deposition, or it looks like you're going to be somebody who at some point in time is going to have a valve replacement, they can start you on antibiotics, narrow spectrum antibiotics, narrow towards gram positives, because that seems to be predominantly what causes this endocarditis most often. And that it won't get rid of the issue, but it'll slow down the progression, give more time for other options short of valve replacement.